So with individuals with stroke, sometimes success is better communication with family members. And I know I've recently had a patient who was a younger individual who experienced a stroke and was having significant challenges parenting teenage children. It's very difficult for those teenagers to listen when they're not quite sure what you're saying. So through therapy, we're able to get to a place where this individual feels like they can communicate so much better with the world, and especially their children, so they can talk in a way that is understood by their children, and also in a way that their children can understand from a cognitive perspective. It's a better match now. And that's a huge success when you're able to communicate with those you love in a better and more clear way.
So a stroke is a type of brain injury, and essentially it means that the blood flow to the brain has been disrupted in some way. Essentially, it's a brain attack. Mm-hmm. And when that happens, things can change with the way the person thinks, how they can use language. Maybe it's more challenging for them to express what they want to say, or perhaps understand others. And we really look forward to helping people when they've had a stroke on that recovery path. You know, we help people at any age. Some people have strokes in their 20s. A person's age does not determine whether or not they would have a stroke. A person can have a stroke at almost any age, from their early 20s, 60s, what have you.
Strokes are trickier to spot in younger people. And so oftentimes we're seeing significant impact from those strokes on day-to-day life. And we're seeing those people who are having strokes in their working years have a difficult time transitioning back to work sometimes. And when they're having a difficult time transitioning back to work, we're seeing a need for strategies. We're seeing a need for accommodations at the work level. We're seeing a need for communication strategies and working on skills that will help them to cognitively be able to do what they were doing before as well.
When a person's had a stroke, sometimes they receive the services that they need right away, and sometimes they don't. Recently, I started working with somebody whose stroke was around 8 or 9 years ago. And when I started working with this individual, based on their report, it became apparent that maybe some of the things that were addressed initially to help them with their language impairments were not totally geared to what they needed at that point in time. Hard to say, I wasn't there, but the thing is this person has started to work with me and has since seen gains that they have not experienced over the last 8 years. Which is really amazing. You can still make a nice positive change in someone's life, even if it's 5-10 years after their stroke.
I think it's that idea of neuroplasticity. Our brains can change for the better, even after several years post-injury or post-stroke.
And part of it is developing that customized approach to treatment and home programming that helps that person to rehab their brain further so that they can recover further, maybe find words better, understand others better. There's a lot of things that change when a person has a stroke.
I think the most interesting people that we work with are the ones who experience such significant improvements even several years after they've had their stroke. And I think people are just starting to realize that, hey, a stroke is another kind of brain injury. My brain is injured. It's not working the same as it was. That area that the stroke was present in, communication in the brain is jumbled up. It's not going the way it should. Those are the people that should come and see us. We can provide sometimes rehabilitative tasks for those individuals, but oftentimes a great basis of compensatory strategies with which to build so they can better communicate with the world around them, their families, participate in social events more readily. They can even participate in their workforce more actively and competitively.
The thing with stroke too is it's often also called a CVA or cerebrovascular accident. So if you have the diagnosis of a CVA, it means you've had a stroke, and that in itself is a brain injury. Mm-hmm. And oftentimes those types of injury warrant some type of therapy. And the therapy that we provide is very customized to that individual. We like to learn from that person what's going well and not well so that we can really help them.
I think the other part is a stroke is not always a blockage. Sometimes we have different types of events like an aneurysm where it's a brain bleed. And so those are a little bit different from a stroke in how they present, but the need for compensatory strategies, the need for rehabilitation is the same.
So if you know someone who's had a stroke and you see that they are struggling, please give us a call. We offer free consultations. We would be more than happy to talk with you and your family member about what's changed and how we can in turn help you.